We are still experiencing thousands of new cases every day. Today, the Indiana Department of Health reports nearly 4,900 new coronavirus cases. That's slightly lower than yesterday, but not by much. Today, we caught up with Governor Eric Holcomb, asking him about his message as the rise in COVID cases is now overwhelming Indiana's hospital system.
We'll continue to appeal to Hoosiers to get vaccinated. This is how we reduce the inpatient load. When you look at some counties, there's a direct correlation between vaccination rates and hospitalizations. And when you look at the percentage, and I sound like a skipping record, I know, but when you look at the 97, 98, 99% of the folks that are going in the hospital are unvaccinated. And it's causing the very best among us, healthcare workers who have been doing double, triple shifts, to say, I can't take it anymore. I just can't take it, especially when people won't take it upon themselves to avoid these dire ultimate outcomes.
And today, another surge in hospitalizations. Data from the Indiana Department of Health shows that as of yesterday, 2,186 people were in Indiana hospitals for COVID-related reasons. The last time COVID hospitalizations were this high was back in January. And tonight, a grim warning from the state's health commissioner.
Things are going to get worse if Hoosiers do not start wearing masks to prevent transmission and more Hoosiers don't get vaccinated. We are going to see cases continue to increase probably till right after Labor Day, and then we will see hospitalizations follow as far as their increase within that next 2 to 3 weeks.
In fact, the hospitalizations have increased so much recently, it's prompted IU Health to suspend half of their elective surgeries and procedures beginning Monday. They say this move is needed to make sure inpatient space is available for those who need it most. And according to IU Health, elective procedures can vary broadly. They can be anything from a cosmetic procedure to joint replacement. Doctors at IU Health are working with each patient who has had their procedure rescheduled. And as COVID-19 cases continue to rise, there is no statewide mask mandate for schools. Decisions regarding a mandate are still being left to the local level, including individual school districts. But despite this, Dr. Box and Dr. Lindsay Weaver said today masking in school works and should be happening anyway.
We have said from the very beginning, the middle of the summer, even sooner than that, that all students, teachers, and staff should go back to school and they should be masked. And that would be the way that we would decrease transmission in schools and be able to, along with vaccinating those children when they're eligible, keep schools open to in-person education.
Again, as of right now, it's up to each school district as to whether they will require masks or not.
If you don't want to do it for yourself, do it for me. Because I have emphysema and I have a zero immune system. It would take the slightest dose probably of COVID to be the end of me.
Starting next month, COVID booster shots could be available to the general population, but right now it's available to immunocompromised patients. And tonight we're talking to a man who just got his booster. He previously had a transplant surgery. Our Nikki Dementri joining us live from downtown Indianapolis tonight. So Nikki, what is this message from this guy that he wants everyone to hear tonight?
Well, first, Mark, some 10,000 immunocompromised